Good morning. 45 million people in the world are blind. 80% of blindness is either curable or preventable. To put it another way, 4 out of 5 people who are blind don't need to be. So that means that there are 36 million people in the world who are needlessly blind. That's comparable to the entire population of Canada or California. Okay. About 90% of the world's blind live in low-income countries in Africa and Asia where access to medical care is poor. Blindness uproots lives. It transforms families. It affects our physical and emotional well-being. It impacts our ability to earn a livelihood and learn about our world. The life expectancy of a blind person is about 1/3 that of a seeing person the same age. About half of all blindness is due to cataract, a clouding of the lens of the eye. Cataract formation is a natural process that's usually seen with aging. The lens of the eye becomes progressively cloudy, blocking light from reaching the back of the eye. In developed countries, almost nobody goes blind from cataract. And that's because there's a relatively simple operation that can be done to remove the cloudy lens from the eye and replace it with a plastic one. The surgery takes as little as 4 minutes, and it's done under a local anesthetic. A skilled surgeon can perform dozens of cataract operations in one day. And the surgery is straightforward enough that other healthcare personnel can be trained to perform it. A major factor in higher blindness rates in developing countries is the relative scarcity of eye surgeons. In rich countries like Japan, France, and the United States, the number of ophthalmologists per million population ranges between 60 to over 100. In India, the number is 9. In Tanzania and other sub-Saharan African countries, it's 1. And that's why I devoted part of my career to helping fight blindness in developing countries. I joined an organization 12 years ago called SEE International that pairs American ophthalmologists with clinics in need of eye surgeons in developing countries. My first assignment was the city of Nakuru, which is about 2 hours outside of Nairobi in Kenya. In the 10 days that I spent there, we performed 144 vision restoring operations. It's hard for me to explain the happiness I felt on the first day after surgery when I saw my patients. And a lot of these patients were seeing for the first time in years. This gentleman had just had surgery on his right eye the previous day. He came to the hospital not being able to see even a hand waving in front of his face. And the next day, he could see almost normally with his right eye. And I think you might be able to see that he still has a white cataract in his left eye, but he could see out of his right eye now. My next assignment was the city of Jodhpur, which is in the Rajasthan region of India. My host ophthalmologist and I attended several outreach clinics in the villages surrounding Jodhpur. We saw many people with eye problems, including this little girl who was born with bilateral cataracts, and this one who was night blind because of vitamin A deficiency. In all, we performed 127 vision restoring operations, which was wonderful, but I was appalled by the conditions in the hospital. Much of the equipment was either antiquated or just didn't work. I was surprised to see that the hospital even lacked a basic sterilizer to clean instruments between cases, so a lot of patients were being exposed to potentially harmful pathogens like HIV and hepatitis virus. This was the pre-op area where people waited their turn for surgery. I was deeply moved by my experience in Jodhpur. I could see that the doctors were doing the best they could with very difficult conditions. And so I promised my host doctor, Dr. Desai, that when I got back home, I'd find a way to buy the sterilizer the hospital needed. And that's where the Fiat Lux Foundation was born. Fiat Lux in Latin means let there be light. My wife Lisa and I started the foundation back in 2010 with the immediate goal of raising $10,000 so we could buy that sterilizer for the hospital in India. We hit up friends, family, neighbors, patients, and within a month, we'd raised enough money to meet our goal. In fact, fundraising had gone so well that we decided to set a new goal. I'd been invited back to Africa by Dr. Wanjiku Mathenge, an old friend of mine who was the ophthalmologist I spent time with my first time in Kenya. She needed some help with her new clinic, and so she emailed me a wish list of many items that they needed in their clinic, and she asked me if I could bring one or two of them with me when I came. Dr. Mathenge had married a Rwandan ophthalmologist. Now the two of them lived and worked in Kigali, the capital city of Rwanda. Thanks to generous donations from our supporters, we raised enough money that I was able to deliver over $100,000 worth of equipment to her clinic, basically everything on her wish list. This included 2 lasers, an ultrasound, and 14 big boxes of surgical and diagnostic equipment. Oh, we operated on 112 patients, many of whom would otherwise have had no access to surgical eye care. And the smiles on the faces of the patients on the first day after surgery, as usual, were priceless. We were so thrilled with our fundraising success that the board of our nonprofit decided to embark on a new, more ambitious goal. I'd heard about an ophthalmologist in Kenya who was trying to build an eye hospital but didn't have the funds to finish his project. Dr. Dan Kiage is an ophthalmologist who gave up a busy private practice in Nairobi to pursue his dream of building an eye hospital that would serve the needs of the people of his native region. Kisii is a medium-sized city in the southwest corner of Kenya, near Lake Victoria. It and the surrounding 6 counties have a population of 5.2 million people, with only 4 ophthalmologists, 2 of whom could operate. With the support of our foundation, Dr. Kiage was able to realize his dream, to build an eye hospital, center of excellence in Western Kenya, a for-profit hospital with a social mission of providing care to all regardless of ability to pay. The hospital had its grand opening in November 2013. It was and still is the only hospital in the region that is dedicated exclusively to providing eye care. Because it runs on a model that requires patients who can afford to pay for it to pay for their eye care, it is well on its way to becoming financially self-sufficient and independent of foreign aid. The hospital contains outpatient treatment areas with state-of-the-art equipment, modern, clean operating rooms, a dispensing pharmacy, an eyeglass shop where people can buy inexpensive glasses, overnight accommodations for patients visiting from out of town, and even a van that can travel to remote areas and bring patients back to Kisii for their surgery. The hospital has the capacity to deliver 82,000 eye exams and 5,000 cataract operations in 1 year. Last summer, a group of American volunteers traveled to Kisii to give Dr. Kiage some assistance with his new hospital. Our team included a pediatric ophthalmologist, Dr. Kevin Merrill. We attended several screening clinics in the villages surrounding Kisii and performed over 600 free eye exams over the 1 week period we were there. And we performed 60 operations, including one on this grandmother who was blind from cataract. So what's the cost of a cataract operation? Well, in a lot of developing countries, it can cost as little as $25 per surgery. The economic impact of blindness is staggering. 90% of people who are blind can't work. Poverty and blindness go hand in hand. Poverty predisposes to blindness. Blindness exacerbates poverty by limiting employment opportunities and incurring treatment costs. Blindness has a profound impact on household finances. The blind family member often requires a seeing person to care for him. Effectively, 2 income-producing members of the family are lost. Sudden blindness in one individual can be the tipping point for survival in a family that's already struggling with poverty. Furthermore, children can't attend school if they have to become caretakers for blind adults. So countless children are denied the opportunity to receive a formal education and possibly escape the poverty cycle. There are national costs to consider as well. It's been estimated that by eliminating avoidable blindness, the world economy can reap a minimum economic benefit of $102 billion. This is by increasing productivity and decreasing healthcare and social service costs. Cataract surgery has been shown to be one of the most cost-effective healthcare interventions. And this has been shown time and time again in studies over the past 30 years. The economic return on investment is very high. When I think back on my career, and I've operated on thousands of patients, this one sticks out. It was a 1-year-old boy from rural Kenya. I could tell from his clothes that his family was poor. His mother brought him to the hospital and said, "Please, can you help us?" He had been born blind with bilateral cataracts. I operated on both of his eyes on the same day, and this is his picture on the first day after surgery when he saw his mother's face for the first time. That was 12 years ago, and I still think about this boy. I like to think that he was able to go to school, that he was able to read, that someday he'll be able to get a job and help support his family, maybe have his own family, and just live a normal life, all because of the 15 minutes that I spent with him 12 years ago. Our foundation's work in Kisi is done, but the Fiat Lux Foundation is just getting started. Our next project will be to develop an ophthalmology training program where we can prepare the next generation of surgeons to join us in the battle against blindness. Eliminating avoidable blindness doesn't require any research breakthroughs. It doesn't require new technology. All it requires is our collective will as a global community. We've made good progress, and we're on the cusp of a remarkable achievement, the elimination of worldwide blindness. Thank you very much.